Well, welcome back to More About Birth. We are here with a very special episode. Shannon, what is today's episode?
We're going to talk about sex.
Angie, what are you reading?
And here's Angie over here trying to cram for this podcast.
I don't know anything about this
She has
topic.
3 children, but you know. So what we're going to do is talk about first trimester. We're going to talk about sex in second and third trimester. And then after the break, we'll come back and we'll talk about postpartum sex and just some of the issues, some of the questions that moms have. And we're just going to be honest and open about this. So are you ready
We're
yet?
going to try to be anyways.
Are you ready yet? Do you understand
I'm just
it all
checking
now?
out. I've never read this book, Making Love During Pregnancy. So
It's actually a book I had to read when I was in midwifery school. Try even finding a book like this. It was really hard to find. It's old. I think it's like 1970 or something is the publication date. And I have it in my library if anyone's ever interested in checking it out.
no shame.
No shame.
Yeah, no shame. It's got a lot of people's testimonials about their feelings about it. There's a lot of graphic sketches in it. So,
Warning.
yeah, warning. This is not a coffee table book. All right.
So let me just ask as the producer, what is the purpose of this podcast?
To embarrass you.
No, in reality, because the conversation, and we talk obviously off camera, and then we're on the live podcast now, or on the podcast that's going live. And it's a major shakeup, right? In average in a relationship, because you have kind of a pattern and you have a relationship, and then all of a sudden a baby comes into the world or pregnancy comes in the world and things change. I think it's a conversation, like you have said over and over again, that we need to have, as uncomfortable as some of these conversations are.
And we were just talking about this. Back in the day, midwifery school, early in marriage, some of this stuff was so embarrassing to me. I was so shy. And I literally was told in midwifery school, these things that you're uncomfortable with, these body parts, these terms, walk around the house saying them out loud until they become comfortable with you. Because I can't have clients sit in front of me and act all shy and embarrassed and uncomfortable about things.
I think
that's going to make them feel uncomfortable.
I think if you go around the house saying uncomfortable words, there's a clinical term for that, isn't there?
Tourette's.
Yeah. Not to make fun of anybody with Tourette's, but they actually have a clinical term for someone who goes around and says bad words.
Don't do this in front of your children. And this podcast should be fairly PG, but warning, we could get into the nitty gritties. So I get lots of questions about sex in the first trimester, especially like, is it okay? What's not okay?
Are these questions from couples as you meet with them, or are they mostly the women that are pregnant?
Questions? No, actually the dads ask more questions than the moms, especially postpartum, and we'll get to that. But yeah.
Okay, mamas, get your hubbies on the podcast.
Yeah, get them in here for real.
So in that first trimester, there are a lot of things going on. There's a lot of hormones going on. Things have increased. Your body's changing. You might be experiencing nausea and tiredness. Let's just talk about a few of the positive things about sex in that first trimester. So under normal circumstances, it is absolutely totally okay to have sex during pregnancy, even that first trimester. One thing that people tell me that is encouraging and is a positive note is that once you're pregnant, you don't have to worry about birth control anymore.
Right.
So it kind of brings a freedom to your sex life, right? We don't have to worry about getting pregnant. So there's not that tension.
You are pregnant.
Exactly.
I wonder how that happened.
Yeah.
Same thing. Yeah. So your hormone levels are changing too. You've got a huge increase in progesterone, estrogen. I mean, there's just all kinds of stuff going on. So those hormones cause things to happen in your body. And one of them is an increased blood flow to the pubic area, which stimulates
bonus.
Yep. It just more easily stimulated, causes you to have more feelings down yonder. I'll try and keep this PG. if nothing else for my husband's sake.
Good
Because
luck with
already
that.
the look on
Hey,
his face is like, I don't know
I'm
about
not
this
on camera
podcast.
on purpose, and don't ruin the podcast on my behalf. I will just blush. I will just blush over here, and you'll know when, because Angie will get that same look on her face,
I might even tell
and
a story
Shannon
or
will
two about it.
will call me out or get nervous across
Yeah.
from me.
No, it's really true though. I mean, I was just reading in your helpful
She
little
was
book
just
here.
cramming and
I was
making
cramming
love during
and,
pregnancy.
Yeah, you know, some women actually experience their first orgasm during pregnancy because of this, you know,
Right.
hormone
Increased blood flow
phenomenon.
and increased hormones.
or
Right.
you know, like super bonus multiple orgasms.
Ooh.
Whoa.
And in reality, hormones are your friend if you are in a relationship,
Yeah.
husband and wife,
Hey,
right?
And it's bonus for hubbies too. So
Yeah.
you're not worried about birth control.
Yep.
You've got this increased blood flow to your nether regions, which causes more interest and more sensitivity. That's a big bonus. What's another positive effect you can think of? I mean, I always think of the fact that you're pregnant.
Yeah, I was just gonna say
You've made this baby together.
Yeah.
And it's just sort of this unique bond.
yeah, it
that-
brings a new level of
Right.
bond. It's kind of like, you know, if you're feeling well enough, it's just a celebratory time. Like, hey, we're becoming a family. It's
Yeah.
exciting.
And unfortunately, more of my mamas tell me that sex is just you've got to be kidding me in that first trimester.
Yep.
So hopefully you're one of the lucky ones that feels the opposite. Some of the negative things.
Mm-hmm.
Pipe in at any time, Angie.
Okay.
So one of the biggies is you are nauseated. Every
Mhm.
time you move too much, you barf. You're tired. You just feel yuck. There's this baby in there the size of a kidney bean, and it's causing all kinds of havoc.
And that's
in your
again the
body.
hormonal change, if I understand
Hormonal
correctly.
changes, yeah. So you're nauseous and you don't feel good. So
Mhm.
honestly, the last thing you want to do is have sex.
Mm-hmm.
So I
Or
said
like-
hormones are your friend. You're saying that hormones
Now
are
hormones
not
aren't your friend. So we're on the flip side now.
It's both. It can be either or.
Mm-hmm. The other thing is there's a huge fear of miscarriage, especially if you've experienced a miscarriage in the past. They are most common in the first eight weeks, less common from 8 to 12, but up to 12 weeks.
And is
you
that
know-
is that caused by sex during that period of time?
We're actually going to get to that in
Cool.
detail. So good question. So we're afraid of bleeding. We're afraid of hurting our baby. Dads especially are kind of wigged out.
Mm-hmm.
I find that more in the last trimester, though, and we will get to that also. But another thing is emotional changes going on.
Mhm.
I don't know about you, but I was kind of a hormonal, like, boohoo, wah in the first
Yeah.
trimester. And you're just like, you just don't feel like yourself. And so you don't feel very sexy.
Right.
You feel like a barfing, tired machine.
Yeah.
Just you don't have it. So sometimes we're uncomfortable with our body in that first trimester. It's changing
Mhm.
so much.
Usually feel more bloated.
Yeah, you don't really look pregnant. You just feel fat and bloaty
Blah, yeah.
sometimes, and your breasts hurt, and
Mm-hmm.
you just don't feel very good. And this isn't true for everybody. I've had women that have absolutely no morning sickness. They're more interested in sex than ever. They feel great about their body. They feel beautiful. So there's two sides
It's probably
to
not
that.
the norm, though. I think it's more normal
Yeah.
to feel yucky.
Yeah, in that first trimester.
Mm-hmm.
And then, later in pregnancy, you got to think about body image and weight gain. Some women just feel like, ooh, I'm gaining weight. This body is foreign to me.
Yeah.
It doesn't feel like me. And a lot of times there's old wives' tales
Mm.
about different things that we're afraid of as far as sex during pregnancy. So one that I hear often is orgasm is going to cause a miscarriage. Well, that is a lie. Actually, your uterus contracts, which is what an orgasm does, is it causes the uterus to contract. So that uterus is contracting the whole time you're pregnant. Why? Because it's a muscle.
Mhm.
It needs to stay strong. Usually, orgasm only causes contractions for about an hour-ish after sex.
Mhm.
And it may start out kind of, you're uncomfortable with it, thinking it's something wrong, and then it just fades away. If it stays painful or they get longer and stronger and closer together, then, you need to let somebody know, or just no more sex. The bleeding, yes, you can have some spotting from sex, but usually that's in what trimester? Usually third trimester.
Yeah.
And pop quiz.
Uh-oh.
What generally causes bleeding or spotting during sex in third trimester?
No pressure.
No right?
pressure at all.
Where's that clock?
What's going on with the cervix?
The cervix is changing. It could already be starting to dilate. It's shortening. So
it's engorged with blood vessels.
Mm-hmm.
So it's engorged with blood vessels. You have sex. What caused the spotting? Think just the action itself?
The friction?
It can break those
Breaks
little
those
blood vessels. Yeah, it can break those little blood vessels. You're so good at pop quizzes.
Plus, contractions in general could do that, right?
Not so much because they're not strong enough, but yeah. So that's one of the old wives' tales, which is a lie, and we will talk about when it truly is not okay. And if you want to pipe in on that, be thinking about when it's not okay.
Okay.
All right. There's an old wives' tale about sex during pregnancy can cause an infection. No, it cannot cause an infection. If you already have one, you can pass it back and forth, but it's not going to cause one. Mm-hmm. There's an old wives' tale about don't have sex when it's time for your period. So like when your monthly cycle would have come,
I had never heard that one. That's interesting.
There's an old wives' tale that says don't have sex during that week or you'll miscarry. Also, especially in like second, third trimester, the old wives' tale that says if you have sex with the man on top, it's going to squish the baby and they'll come out with less amniotic fluid. That's a bunch of bunk. Your baby is so protected. You've got the increased blood volume and thick lining of the uterus. You have 2 layers of the amniotic sac. That amniotic sac is filled with amniotic fluid surrounding the baby like a cushion. Then you've got your abdominal muscles, the uterine muscle, your extra fluff, your skin. I mean, there's many
stronger than a birth ball.
Oh yeah. Oh yeah. Yep. So there actually are times when it's not okay, but just a side note here, all of this is normal. There's not one thing that's just, it's only okay if you feel this way. It's only okay if you feel that way. And I find a lot of moms telling me that their husbands are really uncomfortable with the first trimester. Either they're afraid or they're irritated because their wife says, no sex.
Plus things are different, right? So you're adjusting. So I was going to say the woman's adjusting, obviously, but what about the man? He's adjusting too, because
you need to communicate with your spouse because they need to understand. And I try and educate people in the prenatal appointments that this is normal stuff. And don't be afraid to ask questions. And honestly, if you're not even my client, if you have a question, email me. You don't even have to leave your name. I won't look up your email address.
Yeah. And we care about this, not just about the health for mom and baby, but the health of couples and families. We were just talking about how important this aspect is to your life and your relationship.
It's hard on relationships.
Yeah.
Because I don't know, I'm putting you on the spot, but my husband's our producer. How did it make you feel when things weren't normal in our personal life? I mean, did it make you feel rejected or?
Well, just in general, you feel out of place, right? Because things are changing. And I was thinking when you first started talking on the podcast today, if you don't have good communications, if you can't talk about it, if it's uncomfortable, then it makes it even harder. Because if there's that important topic that you feel is taboo. So for me, I think the older we got, the more kids we had, the easier it was for us to talk about. So I would say for me, the education, even listening to you being a part of this conversation today, you know, thinking about it from the women's perspective, but there's guys out there too, hopefully listening that are like me where, I felt rejected at times. Confused because I didn't know what the right thing to do, which is the baby experience in general, right? What do you do when you're carrying?
It's all new, right?
So I try, I like every man out there, I think that's in love, you try to be as loving as you can and as respectful as you can. But at the same time, that makes me feel connected. So, you struggle when you're not.
It's hard for them because they're not feeling all this stuff. We look normal from the outside, but they have no idea the horror, nausea, and just extreme tiredness that you can feel like in that first trimester, especially. So it's hard to relate.
Right.
Yeah.
And in all fairness, I survived. We've had 4 kids.
You survived.
Yeah.
We even joke. We would joke, after you have a couple kids, you figure it all out, and you're like, okay, honey, here we go. It's gonna be sparse for the next 12.
Yeah, right.
The next 12
Get it while
weeks.
you can.
Yep, gonna be sparse for the next 12 weeks.
Well, and I
for
think
the next 5 years, gonna be,
next 18 years, whatever.
But in all fairness, I would say, being educated and learning how to communicate about it, and us having the conversations, I think like anybody, that's why we're having the conversation today in the podcast.
Yeah.
So there are times when it's not okay though. So talk to me about that.
Yeah. So the times when your midwife or your doctor is going to order what we call pelvic rest, which would be, no sex, nothing in the vagina, no tampons.
Don't try and check yourself.
So that's going to be if your water is broken, your membranes have ruptured.
And why is that?
Because baby's less protected. That's their their germ bubble. That's where they're safe in there. We try not to even check people, as little as possible when the waters have broken.
Don't want to introduce bacteria.
If you're already spotting or cramping or having contractions, that's, you want to wait and not introduce anything else during that time if you're already having that issue. If you have a history of miscarriage in the first 12 weeks, so if you've had recurring miscarriages, you would want to
best to forego for a while.
Yep. Be careful in that first trimester. If you do have some kind of infection, a yeast infection, STD, anything like that going on, you would want to wait because you're just going to pass it back and forth.
Wait until we get it cleared up.
If you're already having preterm labor, regular contractions, you want to practice pelvic rest. And if you're having any pain, whether that's dryness or, pain inside from contractions or muscular things. If you're having pain that you're not sure what it is, wait and talk to your healthcare provider.
Yes. And, along with all that, it's not just sex, it's orgasm in general, which is almost more of a factor than sex itself as far as affecting the uterus. So these are just some kind of feelings that have gone on and things that people have talked to me about. And in the second half of our podcast, I really want to talk about like postpartum sex, because that's a real biggie. That's a real biggie also.
And we have a special announcement.
Yes, we do at the end of the second half of the podcast. Stay tuned and you'll want to hear this announcement. So listen to the end. Let's just go ahead and go to the second half. Take our break.
Yep.
Okay, well, that's the beginning of the sex talk. That's the first half, more about birth. Stay tuned for a special announcement and the nitty-gritty of sex and pregnancy in general and after. We'll be right back. Well, welcome back for the second half of the sex talk. So if your doctor ever says, no wifey for 5 months, what do you do, Shannon?
You do no wife, 5 months.
No wife, 5 months. Oh, what a classic moment that was for us.
Oh, yeah.
I'm looking forward to this second half because we're going to talk about some good stuff.
We are. In fact, to put it all in a nutshell, as soon as that baby's out of your body, you are one big bag of hormones. Your body's kind of like a faucet. This faucet turns on when you're pregnant.
It's leaking
Are
everywhere.
you okay?
It's leaking everywhere.
It's a leaky faucet.
No, the faucet illustration threw her.
This handle turns on and all these hormones pour out that help you grow your baby. Angie, get it together.
Sorry, I'm just thinking postpartum faucets coming out the bottom.
You
It's
got
coming
it
out
coming
your
out.
boobs.
It's
Coming out
everywhere.
your eyes.
It's everywhere. But
Okay.
as soon as that baby is in your body. You've got all these hormones nurturing it and growing it and making sure it stays safe. Then those hormones switch when you're in labor, and some rise, some fall, and that gets your baby out. As soon as that baby's out, tank. Most of those hormones just instantly tank. And you get a whole nother set of hormones that start coming along, like prolactin, relaxin, all these things that cause different feelings in your body and different reactions. So what's the biggest complaint we hear from everybody after the baby's born? They're not interested, but who is?
Yeah, this creates a lot of tension between mom and dad.
A lot.
Because dad's not been pregnant. He hasn't just pushed a baby out, and his hormones have not changed one little bit. Except he's probably feeling like, a daddy and connecting with his baby. Right. But that's it. But
the hormones are still raging. Ours are dying. Right. Theirs are still raging.
Right. Plus, with guys, it would be like the baby being born would be the finish line. And that's the starting point in reality.
Exactly.
Oh, yeah. So, that prolactin goes up. And prolactin has all kinds of different effects on your body. I mean, it causes your interest to be low. Other hormones dive, and it causes a lot of times pretty severe vaginal dryness. So then things aren't as comfortable. You've got a body that just went through labor. It's tired. Maybe you were up all night laboring, and your body's tired, and now your baby isn't sleeping all the night. Baby's up all night and wants to stay awake or sleep in the daytime. So you haven't been able to catch up on this sleep. And we all know how when we feel tired, we're more irritable, we're more sensitive to things, and we just don't have the same amount of patience.
Yeah. So what's the remedy?
Sleep.
Sleep, huh?
Sleep. You've got to give your wife sleep. Feed that baby, go rock your baby.
But Angie just got done saying that that's not what the husband is interested in.
He's not interested in sleep.
Yeah, well, I just wanted to say, there's just a lot of misconceptions about this postpartum thing and the relationship and the sexual relationship and everything. For instance, I think in a typical OB care, there's a final postpartum visit at 6 weeks. Your doctor might check you out and say, all right, you're healed, you're cleared, go back to normal life. And so you might have that expectation in your head, like, all right, 6 weeks postpartum. I should be
ready at 6 weeks.
And dad was ready the moment that baby popped out. But it's like, you're kind of looking at that typical, all right, 6 week mark, especially if it's your first time baby. This is your first postpartum experience. You're like, we just got to make it those 6 weeks. What would you tell couples about that expectation?
Well, my general rule physically is if you haven't had any stitches, no trauma to your perineum, you're done bleeding and you've not been bleeding for at least 3 days. If you're ready, go ahead and try. But because you're so dry, because of the hormone levels, make sure you use a ton of lubricant, inside, outside, all over everything, because it'll be way more comfortable for you and just slow and easy. Don't be rough.
But because of all those list of things we just talked about, I would say a much maybe better and healthier expectation to have is more like 12 weeks.
Oh, yeah, totally. But you know what? I've had parents that barely waited 2 weeks.
Wow.
And they were done bleeding, and that's all they could think about. And that's fine if your body's ready and there's no trauma to your tissue.
Right.
But yeah, we talk about 12 weeks all the time. We talk about 12 weeks being the point where baby kind of puts itself on a schedule, feeding and sleeping. 12 weeks being the point where your hormones kind of level out and you don't feel some of that baby blue stuff going on.
Yeah.
12 weeks is the magic thing for your body.
And the perfect tool, men, if you're listening, to not have any interest at all is go ahead and say yes to changing baby diapers. Because that'll pretty well cure you. You may not want to eat and you may not want any sex.
You're like, I don't want to make another one of these.
Newborn babies, they don't smell.
But you know what? There's more to your physical relationship and your bond and your oneness besides just sex. I mean, we've all heard the joke. Women are like, oh, I just want you to hold me. Right? Well, sometimes you just want held. There's other creative ways to love each other. One of the big things I remember is you're like, especially with the first one, how am I going to work this? So I never know when the baby wants to eat. I don't know how long the baby's going to sleep once I put him down. And my first one slept 20 minutes at a time. That was it. So if you were going to do something, it had to be fast because you
so romantic, right?
I know. Seriously, that's part of it. The romance is gone, right?
Get in, get out.
We have to, it has to be quick. You have to just look at each other and go, oh, baby just went to sleep. Quick, let's go. There's no real spontaneity.
Yeah.
It has to be planned, and it just changes things. Another thing that is never brought up, and over the years, I've had a couple of clients who are very embarrassed about asking about this, but after birth, they were unable to have sex because of a condition called vaginismus. Have you heard of it? It's a tightening of the muscles.
No.
And it actually takes physical therapy to learn to relax those muscles.
Wow.
So you can go to a physical therapist. It causes very, very painful sex, or you can't even do it because the muscles tighten up so bad.
Is that a result of like birth trauma or?
I'm not sure. I'm not sure.
Sounds like a podcast guest coming up to talk about that issue. I do
want to have someone.
We need a sexpert.
A sexpert. So sometimes people have vaginismus before birth and then it goes away after.
Yeah.
And there are also some exercises that you can do, you and your husband, and I do have information on that, but don't be afraid to ask someone about these things because sex is a very important part of your married life, and you need to work through that stuff because, like Angie mentioned, it sometimes can actually make your marriage crumble.
Yeah.
You know?
Yeah. I just feel so passionate about this topic. And, again, I was just talking with our family friend that kind of had their marriage really fall apart beginning postpartum. And this was a huge aspect of that. This was a huge piece, this postpartum sexual relationship, just the husband-wife relationship in general. But his advice for us in preparing for this podcast was just about communication.
I was just going to say,
it's just like you cannot overemphasize the need to communicate, because I think if you can at least understand where the other person is coming from and why they're feeling the way that they do, it at least helps bring some understanding. It can bring patience on both sides and a willingness to wait and a willingness to work through this. But,
and it would even be okay to get counseling about it.
Oh yeah, definitely. Absolutely. Yeah. I just wanted to say, from a birth perspective, especially the first time, maybe every time, but I think especially after your first baby, you feel like a different person. You feel like a different creature, honestly.
It's a biological change in your body.
Yeah, it is. And once you're a mom, there's no going back, you feel like a different person. And so,
that's your entire focus. You are biologically programmed to have your newborn be your total focus.
Yeah. Yeah. And, I just have heard other people talk about, and I feel like I experienced, that first intercourse after having a baby can feel like the first time all over again.
The sensation.
Just the sensation, the feeling internally, just in like in your emotions, in your mental state. And so just to keep that in mind and to not rush. Nope. Just let it unfold. Let it take its time, because you just really can feel like a different creature for a while.
That I hear, and I have experienced this too after that first time after baby, is you're such a bag of hormones that like that first orgasm can cause you to literally burst out crying afterwards.
Right.
It's just like all these hormones come flooding in and you're like, what's wrong with me? And you're just, whoa, 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 whoa. It's hormones. They're horrible things.
Plus in reality, let's be realistic. It's a release, right?
Right.
So it's a trigger. And I think that's what we forget. It's one of those things that, that's how God made us. And
I just had this thought. My mom's going to watch this podcast.
I know. I thought that too.
I know.
Terrible.
Hey, Mom, if you're listening, put the headphones down.
Seriously.
No, you know what? My mom's awesome. She's always been so open about things like this.
We should have had her on.
So, hey, before we run out of time, I wanted to say that, there was a moment in my relationship, Shannon, where we got blessed with a book by Dr. Norman Wright on communication keys for your marriage.
Good book.
And man, I tell you what, just learning some of the rules. I just wanted to mention one rule. We're not sponsored. It's not a plug for the book. It just, it made a transformation in our life where we learned this rule that you can not talk right now about the topic, but you have to give the other person a time you will talk.
Yeah, like if I have something I need to talk to him about, and maybe it would have been one of these situations after our babies, I would say, I have something I need to talk to you about. Can we set a time to talk about that? What I'm really saying is I need to talk to you.
Yeah.
And that gives the other person time to wrap their brain around it.
Because we're not already
come at it defensive.
Yeah, because you can be surprised by a topic, and so it was a rule that we made a part of our relationship that really has helped us out. And it's always behind the scenes. We may not set the time, but the clock starts ticking because you've practiced it, and you know that
the rule
she's waiting to talk to me, and at some point I'm going to have to say yes. And the rule is that you give them a time. Let's talk about it in a half hour.
You can't put them off more than 24 hours.
Yeah, it's 24-hour rule. So. Helped us out.
That's good.
So if you like to check out those.
Wait, he always had to. What is it? What is it? Let's talk about it.
Yeah. And I like to talk things out when
let's wait 24 hours.
Yeah. She's processing her answer, and I'm ready.
Yeah. So. Let's do it.
So communication's huge.
Yeah. Yeah. And I just really wanted to leave dads too with, if you rush mom and stress her out, and I see this happen in relationships, especially women that actually care about their husbands and how they feel, but they're just not ready or they're just not able at this point. That's going to put an added stress, an added burden on her plate. And is that really what you want? Because the more stressed she feels about, my husband's needy and I'm not meeting his needs right now, that's going to stress her out even more. It's going to delay the time that you get to be together even longer. It's kind of not a win situation for anyone. So, be patient with her. And also I wanted to just re-emphasize that when your hormones are programmed to keep that baby alive, it's not her fault. She's not doing it intentionally.
It is a biological thing that happens.
Don't cross Mama Bear.
It's real. You can't shut it off. You literally cannot shut it off. And so
if you were in the middle of sex and your baby cried, you could
it's
care
over.
less about it.
It really
that
is.
That baby needs you.
And it's not because you're, less of a man or she's never going to, care about you anymore. That's not it. It's biological. It's God-given. And I think we need to honor that time. Other cultures do a lot better job than we do about protecting that postpartum time and delaying the sexual relationship and that sort of thing. And so I think if we did a better job of honoring that mother-baby relationship, this wouldn't be such a point of tension.
And something that you can do to help is get her some help.
Yep, absolutely.
Get her some house help. Make the meals. I'm telling you, the less stress on mama, the sooner she's going to be feeling ready to be sexual again.
Plus, if she's stressed, which she's going to be as the husband, the more you can do just because you care and you love them, the more is going to stir up those feelings rather than putting the pressure. The negative pressure isn't going to help.
And the more you push, the more
and you know what? And you might vacuum the whole house, clean all the dishes, do all the laundry for 15 days, buddy. But
she's still not ready. It's not like I did the laundry, so clock's ticking here.
But I will say this: it will be the best date you've had in a while if you've done all that stuff.
Well, and just as we close, I just want to say one more thing. Sometimes you literally have to nurse that baby. Drop the baby off with grandma. She's going to be thrilled to death for an hour, and tell her you're going out to eat dinner and sneak back home and have some uninterrupted time. That can also be helpful.
Yeah.
If you can't stand the thought of being away from your baby for even an hour, get the baby to sleep and just hope for the best. All right.
That's encouraging note, right? Hope for the best. Oh, goodness.
All right. It's time to wrap this up. So we have a special announcement to make. Keith, why don't you do the announcement?
Shannon's not pregnant. That's not
She's not pregnant.
Oh, Lord.
Well, so
like that? Okay.
We decided that we wanted to end this season with this podcast. So stay tuned. Right after this releases today, there's going to be another release on Natural Care Midwifery and on our naturalcaremidwifery.com page, the Facebook page, as well as on YouTube, a special announcement of our season finale live right on Natural Care Midwifery Facebook. So we hope you'll join us there and subscribe, as well as on our YouTube channel. I want to give a special shout out to Shannon and Angie for a great first season. Good job. And thank you for joining us, for being a part of this great journey. And we will have announcements very soon about season 2. So we'll see you then.